it's CJ. Did you know that 6 to 8% of pregnancies are affected by gestational hypertension, what we used to refer to as pregnancy-induced hypertension? That is when you have elevated blood pressures after 20 weeks and your lab work is not consistent with preeclampsia. Now the good news is gestational hypertension isn't nearly as scary as preeclampsia. However, the bad news is it can still cause complications for you as well as the baby. So let's say you go in for your routine visit anytime after 20 weeks. They're going to check your blood pressure. If your top number is greater than 140 or your bottom number is greater than 90, your provider is going to ask some very basic questions. Have you been having more headaches than normal? Have you noticed any changes in your vision, such as black spots, flashing lights, or tunnel vision? Have you been having pain in your upper abdomen? Have you been having pain in your upper abdomen, specifically on your right side? They will probably want to get some lab work to make sure you're not spilling an excess amount of protein in your urine and to make sure that your liver is functioning okay. If your lab work all comes back fine, they will probably have you come in for a repeat blood pressure. You are not diagnosed with gestational hypertension until you have 2 elevated blood pressures, and they have to be a minimum of 6 hours apart. So if you come back a day or 2 later and your blood pressure is normal, they will refer to that as what's called an isolated elevated blood pressure. They'll keep a close eye on you, make sure you're well aware of the symptoms of high blood pressure. Again, severe headache, visual changes, and pain in your upper abdomen on the right side. If your blood pressure is elevated once again, you will be diagnosed with gestational hypertension. Depending on how far along you are and how high your blood pressures are, your provider may start you on medication to get that blood pressure under control. They're going to want to order growth scans about every 3 to 4 weeks, and you will probably have a weekly non-stress test or biophysical profile to keep a close eye on that placenta. Most likely, induction of labor will be recommended right around 37 weeks. So what are some things that you can do to help avoid the complications associated with gestational hypertension? Number 1, make sure you go to your prenatal visits on a regular basis. Number 2, if you are given medication, take it as prescribed. Number 3, make sure you're following a healthy diet that doesn't have a lot of excess salt in it. Number 4, try to exercise on a regular basis. Number 5, avoid alcohol as well as tobacco use during your pregnancy. Number 6, maintain a healthy weight. And number 7, rest whenever you can. Here's the good news. Gestational hypertension usually goes away as soon as you have that baby. So what questions do you have about gestational hypertension? I hope you'll leave those in the comment section below. Oh, and while you're in that comment section, if you'd hit the like button, I sure would appreciate that too.
You're still here. Thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CJ. I'm at your cervix.